I'm Leslie Brown. I'm a family nurse practitioner. I've been with TargetCare here at Old Dominion since the clinic opened, which is January of 2018. So at TargetCare, we offer a variety of services. We do health coaching, whether that's for, say, weight loss, lifestyle management, exercise, that sort of thing. We offer acute care services for minor illnesses and conditions that can be treated fairly simply. And then we help to manage chronic disease, such as diabetes, hypertension, heart disease, and a multitude of things that people may have. And we serve as a liaison between the primary care physician and the patient, help to answer questions, help to educate, and help patients kind of navigate the medical system if they need to see specialists, if they have questions before they make appointments with specialists. We can provide that kind of consulting for them as well. So we also have a dispensing pharmacy here in the clinic, and I have probably about 15 or so medications that can be dispensed. So I think that one of the main benefits of having a TargetCare clinic here at Old Dominion is easy accessibility. Patients don't have to leave work to see their primary. They don't have to leave to go to a pharmacy to pick up a prescription if it's one that we carry here. It can help them decide if they need to see somebody. Additionally, we do blood work here, and that saves them an extra trip out to either LabCorp or their office, and we can have that available to them. They can take it to their primary care visit. Again, it saves them time and a trip. And they like the personalized care. They're not waiting in a waiting room. They're not waiting for hours. They aren't waiting for weeks to get appointments. So it's really, really convenient for them. And so far, I think it's been very well received. So in order to use the clinic at Old Dominion, we first ask that you do a right-on-target assessment. It's a very simple appointment. We'll have you come in fasting to do some blood work. We'll take some measurements, your waist measurement, blood pressure, heart rate, have you answer a questionnaire. And that information all gets put into a system to calculate what we call a risk report. And then we'll have a follow-up appointment, get medical history, find out what medications you're on, and kind of get an assessment of what your goals are and how we can help you with that. You'll get a copy of the blood work, a copy of the risk report, and then you can use the clinic as often as you need for whatever you need the clinic for. So the medical records that we keep through the clinic are very confidential. Nobody has access to that. In fact, they're not accessible by other providers either. They're strictly for the clinic, and I have access to it. That's about it. So the reason that we really encourage you to have a right-on-target assessment is so that we get to know who you are, we get to know your medical history and your medical needs, and then you can have access. It gives us a good baseline to help treat you better if you're in for an acute care visit, or even for health coaching for that matter. And additionally, when these are done on an annual basis, you really get to see the benefit of changes that you've made year to year. You can watch that risk number be reduced. You can set new goals. It keeps you accountable and on track for meeting those healthcare goals that you have. Our right-on-target assessments for the upcoming year are going to begin the week of November, the first week of November, November 2nd through November 5th. We'll start seeing people at 7:30 in the morning and have appointments every 10 minutes. We'll ask you to come in fasting. You should have access to the paperwork to be able to complete that ahead of time. If not, we'll have that available for you and move you through the process pretty quickly. And following that, we'll schedule you for your review about a week or so after that, where we'll go over the reports and the blood work and provide you with copies of that. To schedule for the right-on-target assessment, you can access that online on the appointment calendar, or you can call TargetCare directly, or if I see you in the clinic before that week, I can schedule you. As a reminder, before your right-on-target assessment appointment, we're asked that you be fasting and have plenty of water that morning, and also bring the completed healthcare questionnaire and the signed consent for treatment. So one more bonus to doing the right-on-target assessment is that if you schedule for the assessment and complete that and attend the review session, you'll be entered into a daily drawing for a $150 gift card. So if there are any concerns regarding COVID-19 and coming to the clinic or the customer lounge for the assessments, please be assured that we will have everything will be cleaned. There'll be plenty of distancing. We're asking that everybody wear their mask, and we'll keep you as safe as we absolutely can. if you have any other questions about what the clinic can provide or the Right on Target assessment, don't hesitate to reach out to me in the clinic. I'll be glad to answer questions, and the TargetCare office can also answer questions for you. The most rewarding part for me for being able to work here at Old Dominion in the TargetCare clinic is really getting to know the employees. Now it's been almost 3 years. I've gotten to know people pretty well, get a sense of the demands of their work, what they're dealing with in their personal life, and really getting to know them enough to be able to help them with their healthcare needs and their lifestyle changes that they want to make. So it's been very, very enjoyable.